My name is Cynthia McFadden, and I am from NBC News, and I'm happy to say I've done many stories over the years with the folks at Child Mind. At one point, I joked that I should just have an office there and maybe see a few patients, but they didn't like that idea. Anyhow, it's great to see you all here tonight, and I must say, I think before I introduce everyone, let me just start by introducing Nancy, who produced this film. And I want to just say thank you. It's a beautiful piece of work.
Thank you so much.
Nancy Armstrong is the executive producer of the Disruptors. Also here, we have two clinicians. Dr. David Anderson is sitting next to me, who is the vice president of school and community programs and a senior psychologist in the ADHD and Behavior Disorders Center. Boy, that's a big one, at the Child Mind Institute. And then Dr. Roy Boorady is the senior child and adolescent psychiatrist at the Child Mind Institute and one of America's top doctors, according to the numerous sources. Thank you, that was good. According to Harold and numerous sources. So thank you for being here to talk about this, and thank you as well. Is this mic okay now? Can you hear all right? It's a little crackly up here. Well, so many diagnoses and so little understanding. I mean, I think in a way, as I watched the film, I think we all think we know what ADHD is. I think we all think we can diagnose it ourselves pretty well. And I think that one of the beauties of your film is that we learn a lot that I suspect most of us didn't know. And beyond that, the whole idea that it can be a superpower is a pretty interesting one to explore. So let me ask you, Nancy, why did you make this film, and why now?
Oh, thank you so much. Thank you, everyone, for coming, and thank you to Child Mind Institute for hosting this. I'm really so appreciative, and thank you to Cynthia for being here. So I raised, with my husband, 3 children with ADHD, and there was no film. And our experience was really harrowing, really challenging. My son, who says he inspired the film, we struggled. It was chaos in our house for 17 years, and I had also 2 daughters who were later diagnosed. But we didn't know for so long what was going on with him. He and I got kicked out of Mommy and Me class when he was a toddler, just summarily dismissed because he was running around the room and all the other kids were sitting nicely in their mother's laps. And I didn't understand what was happening, and then things kind of escalated from there. He couldn't sit still, he couldn't focus. This was kind of a constant drumbeat in nursery school. And then he had all these sensory issues, and it was just a struggle. So then finally, when he was 8 years old, a psychologist who I had sent him to said, I want you to have him tested. And I said, oh, he's got sensory integration disorder. And he said, I want you to have him tested. So we had him tested, some battery of tests for 6 hours, and he scored in the 96th percentile for hyperactivity. And we were told we had the diagnosis. Now, I didn't think it was necessarily a bad thing, because sitting next to me was my husband, who, as the doctor's reading off the list of symptoms, he was kind of doing this in the chair, and the hand was going up. And I said, oh, what? And he said, I have all those symptoms. And the diagnostician said, well, it's genetic. So I immediately, right off the bat, I thought, okay, well, this can't be that bad. Tim has it, and he's incredibly successful and smart. So it did explain a lot of things at home. But so there began our journey, and I noticed there was no film, and we needed a film. And we sort of were shrouded in secrecy, all going through the K through 12 process, because no one would ever admit their children had ADHD, and we didn't understand why. And teachers really misunderstood it, coaches really misunderstood it. Some teachers were great and so encouraging, but a lot didn't understand it. And it was so demoralizing, I think, for particularly my son, but my girls as well. And these are formative years, so to be told constantly what you're not good at is a really bad way to go through those formative years. So I thought the film could cut through all of the information. There's so much misinformation on the internet. And this film, if I took the top experts and a diverse group of families and some really successful people who had the exact same struggle, that we could reframe ADHD once and for all.
Well, So for those who may not know, just to put a fine point on it, your husband is more than a little successful. Why don't you share with the audience who your husband is?
So my husband is Tim Armstrong. He is a pretty successful entrepreneur. He's founded many companies. He was one of the first 100 employees at Google. When no one knew what Google was, he ran AOL. But he started numerous companies. He's running a new company now, called Flowcode. So he has all of the super skills, all of the creative, the innovative thinking, the conceptual expansion, just the creative cognition. He has all of those things that research tells us people with ADHD have that are strengths. So he has all those things, and he has some other things that he struggles with he calls his Helen Keller things that he's just not good at, but he's been excellent at, putting his energy toward his skills and hiring people around him that are good at the things he's not good at.
Not that I want to do a little diagnosis of him while he's not here, but just...
He might be here.
Is he here? I'm just wondering, he was not diagnosed as a child with ADHD?
No, he was diagnosed with my son in the room.
Amazing. The doctors are shaking knowingly, like this is not unusual. Yes? Not unusual. Go.
Would you like us to expound on that?
Yeah.
No, it's not unusual just because ADHD has a really high genetic loading. Like the highest genetic loadings in psychiatry are around bipolar disorder, psychosis, and ADHD. So odds are, if we're diagnosing a child or adolescent for the first time, someone in their family either has ADHD or has very similar symptoms that perhaps haven't impaired them to the same degree.
Agree?
Totally agree, yes. I mean, you can look at the science in terms of what they call coefficient of heritability, like how much do genes play a role in acquiring something, and probably the highest is like height or hair color. And for psychiatry, ADHD is right behind it in terms of the rate of inheritance. And I could be sitting in the office and going through the symptoms, and one of the parents would be shaking their heads. Usually I'll ask a question like, does so-and-so remind you of someone else in the family? And sometimes they'll say, they remind me of me when I was growing up. But when I was growing up, I didn't have, there wasn't the testing, there wasn't the knowledge, or there wasn't, maybe the professionals to help with the diagnosis.
So Nancy talks about diagnosis. You're talking about diagnosis. It's not like a blood test. You can't say, aha. But are you now confident that there are ways to definitively diagnose ADHD?
That's an interesting question. So in terms of confidence, it's that we have a set of reliable symptoms that we have, isolated through research, where if you're a well-trained clinician who's doing a diagnostic evaluation where you're ruling in those symptoms while also checking for a variety of other organic causes and ruling out a variety of other mental health disorders, yes, we can be pretty confident in the diagnosis. Now, if all of you heard me hedging a heck of a lot just there, that's because we still don't have objective markers of this diagnosis. Our science is still not in its most optimum place. You heard people at the beginning of the film talking about how the name isn't exactly something everyone's happy with just yet. Brain-based understanding, as Nancy had highlighted so well in the film, is kind of at an inchoate state where we're just beginning to understand truly the brain at the kind of granular level we'd like to and be able to target our interventions there. So we're not in the best of all possible worlds. We're in a world where we need a lot of critical clinical training in order to make sure people are recognizing this diagnosis accurately.
And will we one day, Dr. Boorady, have a map of the brain which will allow us to find this alchemy that creates itself into ADHD?
I mean, my answer is yes. I mean, when I started out in training, we didn't even know how the medications worked. This in terms of the Ritalin, the Adderalls, and so on. So even just in these past 20 years, 18 years, there's a lot of labs out there. We're much more sophisticated also in the technology and the imaging studies and so on that we have. There's one part of the film that I thought was really special to have added, and that is now we have long-term studies of following kids on medications, looking at functional MRIs, and there was a comment there made in terms of the improvement of the brain looking like a normal non-ADHD brain for kids on the medications. So the data's coming.
That moment when Bear's mother starts him on the medicine and he just wilts, that was a really powerful moment.
The truth of that moment is, and I'm sure you guys all know this, but Concerta is a time-release medication. So you can't cut a time-release medication in half. I mean, think about it. It all spills out. So basically, poor Bear got an entire day of methylphenidate in one shot. But her pediatrician told her to do that. And that is part of the issue, which is not only are there not enough clinicians that are specialized in ADHD, but pediatricians and primary care physicians need to be trained not only in recognizing ADHD, but also being able to, help with the medication, because in many cases, people don't have access to a specialist. And so they need primary care doctors and pediatricians to be more knowledgeable and not tell them to cut a time-release capsule.
Well, taking medicine is such a fraught issue in so many ways. The kids are oftentimes very young. They're, the sort of, go to your favorite private school in New York, and there's a lot of talk about kids taking it so they can excel, not so they can just function, right? So let's talk about medication. I mean, I guess the answer is, the thing they taught us in law school, the answer was always, it depends. So I guess it depends. But is medication the right way to go?
I'm the psychologist, so I'm going to defer to the psychiatrist on stage.
I guess my answer is what is wrong about the what's wrong about the medication. I mean, I think what I liked about the movie, it does talk about the strengths of ADHD, but I think it really hammered home a powerful message about maintaining a child's self-esteem, their confidence, and their self-awareness, and also the support from his peer group and so on. I mean, these are kids that could clearly wear out their welcome because of their ADHD symptoms. And as I think I'll reiterate what was mentioned in the movie, because I thought it was an important point. This is probably one of the most studied class of medications for children that we have as psychiatrists, as pediatricians, and so on. So there's a lot of data. And yes, we could talk about side effects, but I also worry about the side effects of not treating ADHD and the complications and the consequences of untreated ADHD. So this is not just about getting A's at your private school. It's also, really helping a child be successful.
And the public messaging is so difficult. I mean, there's a sentence that we include in almost every evaluation at the Child Mind Institute. These medications are safe and effective when monitored by a child psychiatrist. And the issue that we have across this country is with different parts of that sentence, where there's often not a lot of great information about how they're used or how they might target ADHD symptoms. There's definitely an incredible shortage of child psychiatrists across the country, or people who are really trained in utilizing these meds. And I think that one of the pieces in the film that I really thought was kind of hitting home was just the notion that, Bear's mom was talking about how the first prescription was from, I believe, an adult provider who didn't necessarily specialize in kids or in this way. And so we see so many parents go through that struggle where they're trying to find the right treatment. I also thought it was incredible. There's a clip in the film where you show the Tom Cruise Matt Lauer interview where Tom tells Matt that he's being glib and then finally tells him about all the research he's done on medicines. And, first of all, that clip is not aged well. Secondly, I used
Watch
to show...
it. NBC's not so happy with that clip.
I'm sorry? What I meant was... but
Wasn't
no,
that on
the thing
ABC?
Is,
no.
I used to show that clip in grad school courses where I'd talk to my students about how that clip has millions upon millions of views reposted on YouTube over and over with millions of views brought to those channels. Whereas we'll put out a video with someone as knowledgeable as you talking about ADHD meds and get 67 views. And no one is really looking for that narrative, and the media messaging is so intense in the other direction.
Yeah, and there's also, there's misuse of the medications, and so that gets highlighted as well, right? And that makes people fearful of them, right? There was a really powerful piece by Casey Schwartz on the front page of the New York Times where she talks about having wonderful young writer, actually a friend of mine, who abused the medications when she was in college in order to sort of get through, and now deeply regrets it. Anyway, that's a topic for another night. I'm really interested. Well, but it does affect what we're talking about, right? Because I'm sure many parents go, "No way, I'm not giving my kids this stuff." Okay, but we'll deal with that in a sec. I'm really curious about how you got both the celebrities and the real families. I mean, in some ways, I'm wondering if getting the families wasn't harder than getting the celebrities. But talk to us about that.
We were really lucky. I mean, I think the families are amazing, and people ask me all the time, what's going on with Hogan? How's Bear? So I think we were lucky to get great families. These parents are killing themselves trying to help their children in all cases. And so I think the parents came on board because they want to do something to make things better. They want to reframe ADHD. They want their children to stop, being stigmatized and isolated and shoved to the side, and they want to debunk the myths about there is no such thing as ADHD. It's really bad parenting and willful children. All these really toxic themes that are pervasive, that prevail, that don't go away, and what we hope that the film undoes. And then with the well-known people in the film, that was something I felt very strongly about. I knew a lot of people that were super successful that had ADHD, and so once we got Will.I.am, who is friends with my husband and I, and he came on board because he thought it was a great idea and he trusted us to do it. Once we got Will, once we got Scott Kelly, I mean, everyone wants to be in the club with the astronaut. So then Paris Hilton, and she's been very vocal about destigmatizing ADHD and helping kids. So this was a passion of hers as well. So once we kind of cobbled that group together, a lot of people came on board, so it wasn't as hard as you might think. But there were people that said no, or that said yes and then said no.
Yeah. You want to name them? You want to tell us?
No, I don't.
Just kidding. Okay.
But women, and I think there was more hesitancy on the part of famous women to let anyone know what's going on under the hood. Whereas the guys that were well known were like, yeah, I've got ADHD. They weren't as concerned with the negative fallout.
That's fascinating. That's a subject for a little investigation.
I mean, the reality is you're capturing something that's been written about related to gender roles and ADHD. It's the fact that, there's a certain maverick quality to thinking about yourself as a creative, innovative male with ADHD, whereas within female populations, it's considered more gender consistent to be suffering from anxiety or depression than it is to be suffering from ADHD, and that ADHD is a more stigmatizing disorder in some ways, at least within that population. So I get it. I wish we could have talked to some of the folks you're talking about, just about how valuable that messaging is.
Yeah. Well, I'm sure they see the film now, and they wish they were in it.
I thought the opening sequence, and I wonder how many of you, my heart was racing as that mother's trying to get to work and he's under the bed and you're just thinking, and what should she say? What can she do? And, the whole idea about labeling a child like that a bad kid. There were so many hard things in that opening sequence.
Well, I was grateful that we had a difficult morning in the film because that is a hallmark parenting ADHD children, is that your mornings are going to be a shit show. Excuse my French.
Go. That's the technical term.
That's the technical term. When my son was in high school, I seriously thought about hiring an off-duty police officer to come to my house with a club to get him out of bed and get him to eat that omelet and peel the banana. So the thing that's interesting, though, is kids with ADHD, when there is a camera crew in the house, the dopamine starts flying, and all of a sudden they're putting dishes in the dishwasher. It's like, okay. So we, with the parents, talked more about it.
There was a solution. Just hire a camera crew to live with you. There you go.
Exactly. So.
But that moment, listen, as someone who shoots these kinds of things, there are those golden moments when they happen and you go, oh, it's horrible, oh, it's great. Yeah. You knew when that was happening it was going to be a moment.
Oh. I hate to say I was crushed when Hogan got suspended, but there was a little part of me that was like, yes. Yeah. Because it was a great story arc, and when, we couldn't get Zara's mother to open up, I think it was Kristen Seymour, who's in the film, said, there's no storyline here. And then finally the mother was able to be, she did not want to, she had she really had her armor on for most of the time we were interviewing her. And then toward the end, we cracked, we were able to get a chink in the armor, which I think was so important because that's so universal as the parental guilt that we feel that we've done a bad job, that we said the wrong thing, that we handled the whole thing improperly with kids that are in their formative years. So I think you see a lot of parental guilt.
Yeah.
So I think that was very universal.
So since we have two doctors here free, let's just ask them. Is there anything that she could have done in those moments when he's under the bed? Could she have handled it differently? Asking for a friend.
I mean, the thing is, even in watching that, it's like we start thinking about the coaching that we do in those particular moments. Now, first, the camera crew affected the kids, but also the parents. I heard no yelling. And that's the piece where it was kind of like,
Right.
oh, she's under the bed. Now they're having a little conversation. I was like, oh, yeah. This is what happens every morning with that level of empathy and validation for the kid who's under the bed. Because I was just sitting there thinking, like, if we're really coaching like a realistic situation right there, I think about the fact that I've had a few parents who we will be on the phone where I'll say, look, put me in your ear. Like, I'll be on an AirPod, or back in the day it was a Bluetooth. And I still remember there was this one parent I was coaching in LA through a morning just like that. And I was saying, like, okay, we're not going to win all of these. But, like, when we're coaching, we're kind of saying, like, look, what you're trying to do is increase the chance that a morning will be successful. And what that means is highlighting successes, trying to walk away from some of these failures. So I had this dad who was walking back and forth to his 7-year-old daughter's room, and he's walking to the kitchen, and he's going, I swear, I'm going to throw her out the window. I'm going to throw all her toys on the street. Like, we're going to be done with this. I said, okay, walk back in the room, tell me what's going on. And I hear him through gritted teeth say, well, she's got one leg of her pants on, and her pajama shirt is still on her body, and it's been 17 minutes. And I was like, I want you to praise the fact that one leg of her pajamas is on, and she's beginning the ritual. And he's like, this is madness. And then, like, 2 minutes later, he's in the kitchen, and he goes, oh my God, she just walked in fully clothed. And I was like, we're throwing a party. And he's like, okay, and I'm like, not every morning will be like this, but this is kind of the nudges that we push to shape a kid so that they don't feel like their self-esteem is crushed. But at the same time, we don't feel like these moments define our lives and cause us to have all these negative kind of interactional patterns.
Ooh.
Yeah, I mean, one trick I have is when I have a daughter in high school still, she's a teenager. It's getting better, but sometimes if I was driving her to school, she'd just be screaming bloody murder in the car. And I would say to myself, I was hired to drive her. I don't know her very well, but I'm being paid a lot, so just gonna, and I would look at her and say, I like your spunk. And she would go, what? What do you mean? So you can disarm them with something positive, or just go hug them when they are the least huggable. You diffuse the whole situation. It's hard to do, but try it.
Can you ever just walk away? Say, okay, don't go to school today.
We're often doing that. I mean, part of behavioral intervention is we're telling parents it doesn't necessarily make sense to have large conversations in those moments. It doesn't actually help anybody. So you want to, utilize what you think is an appropriate consequence and then let the medicine do the work. And that's the hardest thing, is to say to a kid, look, you've lost this privilege for this afternoon, and then to walk away and then come back tomorrow with the understanding that you have to let the consequence do the work, not the yelling do the work.
Wow. Yeah. How many people are really good at that in the audience? Raise your hand. Yeah. I mean, it's rough. It's rough.
Just want to throw out there that I'm a psychologist. My wife is a psychologist. We have a 6 and a 3-year-old. I can give the advice. I'm not saying I'm not screaming some mornings, just with our kids.
There is a lot of fear, I think, and self-blame, and I think parents, whatever the issue might be, especially when it's a psychiatric issue of any kind, right? That parents feel, if I had done a better job, if I had intervened, or all the woulda, shoulda, coulda. I guess, in some ways, I'm wondering, like, is there a difference in the people who go on to have really happy, successful lives and who have transferred through this, and those who have gone through hell with their folks, right? I mean, do you see, is there a coefficient here? Is there some secret sauce that we can know? Or is it just so individual? You're the psychiatrist, yeah.
Just clarify the question again.
Well, I don't know. I was rambling. I don't know. I look at the extremes that you show us. We don't know how the kids are going to do ultimately, right? I mean, we hope for the very best, but we know all kids don't. It doesn't turn out to be the very best, and yet in some cases, people have gone on to be able to work with what they've got and harness it in a way. Is there any predictive quality or any kind of special sauce that we can sprinkle on people so that they can experience themselves in their best? Does that make any sense?
Oh, sure. I mean, the top one in my mind is the families that come in to bring their kids in. The understanding, the support, the knowledge, the work that they do, the being there in the tough times and the easy times. I think the number one ingredient for success is the parents and the families that I see.
And to add to that, I would say getting in early. So the things that predict positive outcomes are often breaking down stigma such that people don't wait what research tells us is on average 4 to 7 years
Whoa.
from the time they notice that something's wrong to the time that they bring their child into a mental health professional's office. To Dr. Brady's point, the families are a second aspect, but it's also kind of the grit that families possess in the sense that ADHD is chronically managed. It does not go away. It doesn't get cured. A certain percentage of adults may move into adulthood less clinically impaired by symptoms, but it's a brain-based set of symptoms. It doesn't go away. So it's that ability to kind of invest honestly in what's going to be the new place that you're at over the course of a period of time, and understanding that you're going to find the joys and the strengths in it, but that there's also going to be a lot of elbow grease involved.
Yeah. And I would imagine that all three of you would say the medicine itself is not going to fix the situation. It has to be the medicine plus.
Correct. I mean, as a psychiatrist who does this, another one of my sayings is, it's not here's a pill and everything's better. And I think Dr. Saltz in the movie also stated that you really need to kind of combine the medication with the supports in place, maybe some behavioral work, clearly as much as we can get the school involved, and sort of, all hands on deck.
Great. We promised that we'd let you all ask a few questions, so we'd be delighted to do that. And I see a hand go up. The first hand in the back. Yes, I don't know, I can't see, but go ahead. That would be you.
Hi. First of all, thank you for making this and reframing everything. I wish I had seen this 5 years ago. I think my question is, how do you feel about, and this is dependent upon the parents, I'm sure, and of course the child and the age of the child, but how do you feel about our kids watching this? Because my son is 13 and I see so many reasons for him to watch this and process it, but I'm sure there might be some that are not. So I'd love to hear your take on whether I can put my son in front of this.
Yeah, I mean, I made the film for your son to watch so that he can understand what ADHD is, which he already knows about the struggle. He's probably well acquainted with that. But to really start to think about his strengths and his super skill set and to view himself through that lens from that point on. So I want your son to watch it. I want him to look at whoever in that film of the well-known personalities he identifies with and says, that person's just like me. So what do I need to do? I need to focus on my strengths, manage my challenges, do what I love, and march forward. I think it's so important for kids to view themselves through the lens of there are some challenges, but there are some pretty significant strengths. And if I can accelerate those strengths, I can have a very successful life. That's the fear of kids with ADHD is I will never make it, because that's all that it looks like in K through 12 to so many of them.
So doctors, is she right? Is this okay for the kids?
I've recommended it to patients as young as 10. I mean, the reality is I'm only thinking about cognitive level of understanding. I don't see the film as doing harm. I see it only as breaking down stigma and giving kind of a sense of a collective path forward that can facilitate discussion between parents and kids.
Dr. Boorady?
Yeah, I agree. I think the thing that struck me about this movie that moved me as well, that it wasn't like a science lecture or going to a doctor's office that could sound pretty sort of medical or scientific. Seeing the stories of not only the famous personalities, which I think is very helpful for kids to help them understand they're not the only ones, but the other families stories, the other
Agreed.
children and so on.
Right, because you only know what you know in your house, right? You don't see.
And even with something that is, I feel, pretty prominent, ADHD, I still have kids today that say, am I the only one?
Oh.
And they could be in 5th grade, 6th, and I'll know that I'm probably seeing 2 or 3 other kids in the same class.
Yeah. By the
But
way,
sometimes kids still feel like sort of lonely with this.
how early is the right age to be diagnosed? I mean, how early can you diagnose?
4.
4.
Yeah.
Yeah.
For kids who have really significant symptoms, particularly with hyperactivity that we see presenting early
Yeah.
on, the peaks, though, are 2nd or 3rd grade, 6th grade, and 9th grade. 2nd or 3rd grade for kids who often have combined presentation. 6th grade is often a time when we start to see females identified, just because they've been flying under the radar with inattentive symptoms for a lot of elementary school. And then 9th grade, because the stakes get higher and people who've been waiting for care suddenly start bringing the kids in.
And then there are the parents who get
The adults.
diagnosed. Right, I was going to say. There you go. Any other questions? Yes, right there.
Thank you. I was really found the moment when Hogan's parents said if he could be. Sorry, I was trying to be really loud. Thank you. I was commenting on Hogan when his parents said if he could have been a hunter or gatherer, he would be really successful. I was curious to hear your perspective on like what education should look like, and maybe for some children, should it be in a really different format that they could be in nature learning, and that would be an environment they could literally excel in, as opposed to being in a traditional classroom. I was just curious if you could share.
And my husband is reading a book called Visual Learning. It was written by Temple Grandin, and she's a visual learner. My husband's a visual learner. My children are all visual learners. I probably am as well. But it talks about how the school is absolutely not set up for that kind of learner, and they tend to be, kids with ADHD. So, it's something to think about in terms of the way we educate kids with just more of a rote way of learning, which, as Ned Hallowell said, is deadening for kids with ADHD. So, some schools are moving toward experiential learning, which is, much more engaging. And but I think it's, when you have a teacher who stands at the front of the room and talks for an hour, there's no learning happening there.
Another question in the back. Here comes the mic.
Hi.
Hi.
I have a 15-year-old daughter diagnosed with ADHD in 3rd grade. And we moved her quickly into Mary McDowell, which has been, life-changing for all of us. What I'm asking about now is, so I have a 15-year-old girl. I know she has the ADHD. What I find challenging is ordinary responsibilities in the house and expectations. Do those need to be modified, or does she need to be held to an ordinary standard that other children would be held to? And I struggle with this because I'm asking her to help around the house, and she has responsibilities, and if she doesn't, there are consequences. And I'm just wondering if, in your opinion, should we, expect that of our children, even those with ADHD?
What a good question. Dr. Boorady, let me start with you.
I was actually going to give it all to.
Too bad I called on you.
Yeah. I have a behavioral specialist here next to me. I mean, I think my answer would be yes, in terms of, because you're also thinking about your child that one day they're going to be out of the house.
Hold it. Yes, you should modify, or yes, you should not?
I mean, there's probably going to be some modifications, but you still want them to acquire the skills to some level in terms of the responsibility, so they could have a sense of, their own sense of accomplishment, their own sense of structure. Because, as I say, one day they'll be out of the house, and if they don't sort of learn and fall and try to learn again with you there to help support them, then you want to be able to set them up to be independent and to take care of themselves.
Okay.
And what I'll add
How
to
did
that.
you do? Good? Yeah?
Yeah, it was great. What I'll add to that is that, two of the talking points we often get, and we get this question a lot in the office, is that we highlight the fact that the mundane, the repetitive, or the non-novel are the absolute hardest things for kids with ADHD. And that if we're talking about the road to shaping, as Dr. Ray was saying, those habits as they launch into adulthood, it's a much more intensive learning process. Every kid picks up certain things naturally, doesn't pick up other things naturally. Kids with ADHD do not pick up routines naturally. I think there was a quote in the movie about starting from scratch every morning. And it's this sense that when we're learning those routines, we tell parents, you're lowering the bar right now because you're lowering it into their zone of proximal development so that you can then shepherd them to where they need to be. Because the issue, and this is the example I always give in intake sessions, is I tell parents, I want you to do a backflip through the front of my office. And they'll say, what are you talking about? And I'll say, well, when you walk through the doorway, do a backflip. And they'll say, well, I can't do a backflip. And I'll say, I made my expectation clear. I'm not lowering the bar. You need to do a backflip through my office door. And then they say, well, I can't do that. And I say, well, in that case, I think maybe we want to start with a forward roll, and you can work up to this. And this is the general learning principle for almost anything. If any of you can do a backflip, I haven't been called on it yet. But like if Simone Biles has a kid, I know that kid's going to be able to do the backflip, and then I'm going to have a problem.
I don't know. I think we should leave it right there, as they say in cable news. Really, thank you all, and especially thank you, Nancy, for making this
thank you
really
so much.
remarkable film. And thanks to all of you for coming tonight.